Hello, hello. So, my name is Danish and I am a product leader here at Health Tech Academy, and we are doing our first ever podcast. And with me today, I have our very own CEO, Shamsah Noorani, who will be joining me and talking about everything that we do here at HTA. And this is very exciting because we have been talking about it for such a long time, and at last we are doing it. How do you feel about it?
Absolutely. I'm so glad to be here. Thank you for having me, Danish.
Perfect. So I think let's jump straight right into it and start off talking about allied healthcare workforce shortage. How do you define that shortage?
Yeah, so that's a really great question, Danish, and thanks for opening with that. There has been a significant shortage in our healthcare system, particularly our frontline workers and within allied healthcare workers. So these positions include medical assistant, phlebotomist, even down to sterile processor, surgical techs. And there are many reasons why we have the shortage in our workforce. Some individuals do end up retiring within the workforce, but the more significant reason is it's the burnout. And the burnout really happens because there is a shortage in the workforce. So we are asking our current team members to work even more, even longer hours. And that doesn't always suit everybody's lifestyle. And when it doesn't suit their lifestyle and there's constant pressure to work more or work longer hours, then that obviously doesn't settle well for a lot of individuals.
But do you think that it's the shortage of enough people into the industry, or do you think it's the people who are not as skilled as they need to be?
No, I think there's definitely a shortage of people coming into healthcare. And that's one of the reasons why we have started Health Tech Academy. Because at Health Tech Academy, or HTA as we call it, we train individuals and provide them the skills, and I want to emphasize, provide them the skills that they need in order to excel and be job ready day one. So basically, our goal here are our programs, the way they're structured. They are short programs available online, self-paced. So individuals that want to come into the healthcare industry can take the programs early in the morning, depending on their lifestyle choices, or even after a full days of work. And they can take the required skills that they need from and learn through our programs and be job ready within 4 to even as little as 4 to 6 months.
Do you think that the industry needing so many people who should be skilled as well, do you think the demand is fulfilled by the education institutes the same way, or do you think the education institutes are not producing enough skilled talent out there for the industry to use them?
So the way the higher education system is set up here in the US, it really is could be very daunting for a lot of individuals. That's because not everybody can dedicate 4 to 5 years of their lives to go to a higher education institution, be it a college or university. And the reasons obviously include, some of them could be the time commitment, the dedication, the financial burden as well. So not everybody has the capacity to take on student loans in that way and to provide that kind of time.
Yeah.
So it's not always a matter of the skills. It's also, a lot of it is also lifestyle choices, and can an individual dedicate that much time and energy and focus?
Do you think there was any role that COVID played in all of this, like, with the demand rising, or people starting to believe in the online healthcare education?
Yeah, so those are actually, I'd like to break that up into two different questions. So when COVID happened and the world moved online, that really has given a glimpse to everybody that we can operate by learning online, by doing majority of what we need online, even down to learning skills and taking your programs and having education online. So yes, I think that that has given a lot of opportunity to individuals to tap into various ways of learning. For example, our programs obviously could be available in a desktop format, in a laptop format, but we're fully compatible on mobile. So you could even be like waiting in line for your train or your bus, and you could be learning at the same time. So yeah, I think that that's really opened a lot of doors for a lot of individuals. And with regards to your second question, right, I think that having programs available and learning how to learn online people have really tapped into that over time. And after COVID, that's just progressed a lot more and a lot faster.
True. But do you think like our students or the potential students have gotten comfortable enough with understanding that online education is a good alternative or even a better alternative to the traditional education that they can find in the colleges? Because I personally believe that absolutely the kind of demand that we see in the industry at the moment, that can probably not be fulfilled by the colleges or the universities because they tend to have much longer programs. So these kind of programs are the need of the hour. But do you think that the people, the user, the potential students have that comfort and confidence on these programs?
Yeah, I think the first step from a student's perspective is to take the step.
Yeah.
Right. And that is by far the most significant and the most challenging. It's the time when the student says, I'm going to do something that's going to change my life. And I stress this a lot, and I say it's not just a matter of changing their own life, it's a matter of changing generations and their family's life, because education truly is the key that allows a person to progress, be it in their career, and have what we refer to as long career paths. So once a student makes that decision, and with Health Tech Academy, and they trust and they instill that trust within HTA, I think that is by far the most significant decision. And once that happens, that's when HTA really takes over the learning. It's not just the learning journey, but it's also entrusting HTA and Health Tech Academy. So we have a lot of different resources that are available for our students. This include our student services that they provide regular check-ins. They work with the student in the methodology and in the communication timeline that the student is available, so that whether it's texting or calling or emails, whatever the student is most comfortable with, but their job really is to make sure that the student is satisfied and has everything that they need in order to be successful and to drive that engagement and to complete the course. That's one aspect. The second aspect is we have career services, and our career services team, their role is to work with the student to get them job ready. So basically interview prepping, resume writing, finding local externships or even positions depending on the program. And again, the career services team is also available to the student day one, and the career services team works with the student hand in hand in order to drive that engagement and motivation and complete. So what I can say is I think that the online format is much more flexible. It caters to that student who is looking for that lifestyle choice to be available at different times. But even if the student is not as comfortable going into this, that's where we come in.
Yeah.
Right. We really work with the student to make them comfortable, to get them acclimated to our courses, to get them much more engaged so that they can complete the program, because our job is to work with them to complete the program, get them job ready, and eventually get them either placed into an externship program or a position.
Makes sense. And I think when we talk about the online education, one thing that I personally think is that a lot of times people do not realize that when they're in the traditional education system, they are kind of forced to study when they're maybe not feeling like that. Maybe they're not in the right mindset, but they still have to be in their class because there is a schedule that they need to follow. But then when they're studying online, like here at HTA, they can do it at the time when they feel that they have all the mental capacity to engage with content and they're ready to learn.
Exactly.
And I think that helps a lot with learning. My next question is that there must be different types of students that we are targeting. So is it a high school graduate that we are targeting, or it can be anybody? Maybe they have a bachelor's in a completely different field, or maybe they have worked in the field for years. What kind of customer segment are we trying to target, and what kind of demand does the industry have with regards to these customers that are going to study here?
Yeah, absolutely. That's a great question as well. So we target individuals who are interested in career shifting and coming into the healthcare industry. So depending on the program that the student is interested, some of our programs have a prerequisite of being in the healthcare industry for a few years. So somebody just coming and graduating out of high school may not be the right fit, but that's why we have career path, because they could start with a particular program and then grow into some of those additional roles. But our programs are open to anybody that is interested in moving into a healthcare career. It could be somebody right out of high school, it could be somebody right out of an associate's degree or some community college, or it could be somebody who's been working in the healthcare industry for a few years or even longer, and wants to grow into that next role. And so we provide them the skills and the education that they need so that they can be job ready day one.
Perfect. And, a lot of people talk about comparing the online education with the traditional education. And I think the biggest problem that they have when it comes to healthcare education is that there are so many skills that you need to acquire that are difficult to acquire when you are not in person. They're like, for a surgical technologist, there are certain instruments that they need to use and they need to get familiar with it. They need to know how to hand it over to the surgeon or the doctor. And they don't know how to do it when it's happening all online. So how do you break that myth that it's not possible online?
Yeah, no, I think that's a great question. So a couple of things that I'd like to emphasize. Again, depending on the program, there may or may not be externships, which are on-demand job training component. So a couple of ways of answering that question, Danish. One is our programs have videos based in, right? So the videos are very high quality, very detailed. They explain to the T exactly how to use instruments, or in certain cases to take vitals, how to go about doing that. Additionally, we measure students on their simulations for particular skills that they're developing. So the student is being tested throughout the program, be it via quizzes, with exams, or even different types of simulations for skills, because we want to make sure that the student is prepped. So I don't think that there's a difference when it comes to doing it online versus doing it in person, and actually, like you said, working with certain instruments, if you will. But more importantly, and probably most importantly, I'd like to provide you an example. So we do train a lot of dental assistants in our organization. And if you look at dental assistants, it's one of those careers that have a significant shortage, and that continues to widen with time. If you talk to the dentist offices, you will come to the conclusion very quickly that they are extremely open and ready to work within students and train them on the job, right? So it's not just a matter of learning and learning it before you show up for the position. A lot of the offices and most of these individuals, most of these dentist offices are completely open. They understand where to meet the student and provide them with the guidance, the support that the student needs in order to be successful at their job.
I absolutely agree, but then there's another aspect where people go like, when you're in a classroom, you have an instructor right in front of you, but then in a self-paced program, it's all on you. If you're not motivated, then you stop learning, or you do not have somebody that you can go to and ask some very specific questions, because I assume the student services and career services would not be trained and they would not be specialized in very technical things. So how do we resolve that here at HTA?
Yeah, that's a great question. So we have subject matter experts and coaches available for our students. And it is mandatory for our students to take and avail these coaches as they move along in the program. So our student services team is guiding the students on when to set up time and have appointments with these coaches. And the goal of the subject matter expert and the coach is to answer those hard questions for the students. If the students are stuck on a particular concept and don't understand it or need a little bit more information, the coach or the subject matter expert, I use those terms interchangeably, they will take the time that the students need to get them comfortable with those topics. So we have been able to manage to overcome that objection from our students. And I also want to say that, everybody learns a little bit differently.
Yeah.
Some people like to learn from instructors and coaches. Some people also learn in more of that environment from each other, from their fellow students. So we have peer-to-peer learning sessions where we have engagements and we have those sessions where our students get to know each other. They can obviously set up private sessions as well, but these are more open and public sessions where they can get to know each other, they can drive engagement that way, and they can learn from each other, right? If somebody doesn't know a particular topic, then or needs a little bit more clarification, they can ask their fellow student.
Perfect. And what about making sure that all the changes that are happening in the healthcare industry and staying relevant to them with AI and technology that is there or all around healthcare? Is there any program that we offer here at HTA that kinds of serves that purpose, where people can learn about, not learn, but stay relevant to what the future is going to look like in the healthcare, with AI and technology being very, very integrated into the healthcare systems?
Yeah, so a couple of things there. One is all of our programs are credentialed. And they are always being updated through our subject matter experts, as well as our instructors. And they have to obviously be more relevant based on the industry standards. So they're always being updated. But to answer your question around AI, what we have done, Danish, is we have our AI companion and our AI coaches available, and they are part of all of our programs. So a student can leverage the AI companion at any point where they come across a difficult topic or they need a little bit more understanding. The AI companion is available 24 hours a day for them to tap into, for them to get their questions answered, to get something a little bit more described. We are very, very highly technology forward here. So our programs already have that AI component.
Which basically means that maybe there are certification exams that do not have certain content that is covered about what is going to happen in future in the healthcare. But AI can, while they talk to the students, AI can probably bring up stuff which is more out of the box, and the students can really get to know that. Maybe it wouldn't help them pass the exam, but it would definitely help them do better in future, because exams is not going to ask very crazy questions. it is going to ask you about what are you going to do day to day. But I think having that AI component can probably give them a lot more understanding, a lot more depth of knowledge that they need to do better in the future. So if you could speak to the future healthcare workers or the potential students that we have, and they're doubtful of whether they should make that decision and take the leap of faith and enroll into one of our programs, what is that one thing that you would really want to say to them?
I would say that the first step is always the hardest, but trust Health Tech Academy. We've been doing this a long time. I myself personally have been in the EdTech field for over 15 years and in online education. So we've been doing this. We understand what it takes. We have a lot of students. We have over 2,000 enrolled students at any given point taking our programs. We're working with a large network of hospitals and clinics and doctors and dentists that need individuals to come in and support them. So I definitely would say take the first step.
Perfect. So rest assured they are in safe hands, and that's what they need to think about.
Absolutely.
Perfect. I think this was a lovely conversation, Shamsa, and I'm really looking forward to the follow-up conversations that we'll have here at the podcast.
Thank you, Danish. I appreciate your time.
Thank you for taking your time. And I would like to say to everybody who was listening in, thank you so much for taking out the time. And we hope that there was something new that you learned about HTA, you learned something new about the healthcare industry. And we hope to see you on this side as our students or as our partners. Thank you so much.